Hola, post and claim. So today was our open house for behavioral health professionals. Unfortunately, no one attended. So I said, "Oh, let me do a video." So I host these open houses because I provide a service of credentialing, which means you go through the credentialing process to receive reimbursement from health insurance carriers for your services. But I run into a lot of times is that people are holding up the process because they don't have their paperwork right. So I wanted to go over the things that you need for the credentialing process to be able to receive reimbursement for your services from health insurance carriers. So the first thing is you have to make sure that everything matches. If things don't match, they're going to deny your application, which that means they're going to return it back to you and say, okay, I'm going to give you 30 days to it's probably less than 30 days. Some of them are like 3 days, some of them are 2 weeks, but the max that I have seen is 30 days. Their return and said, you have 30 days to return this back to me. If not, you're going to have to resubmit your entire application. So what I try my best to make sure that we don't run into that deadline, as in that day that is due. So one thing in performing this service is that everything has to match. So if your tax ID and what your name of your business says, I use my business as example, post and claim. Your MPI number, name of your business need to say the same thing, post and claim. So if I was to submit those to the insurance, to the insurance company for the credentialing process, and if I had claim and post, and then my MPI number says post and claim, they're going to return it back to you for corrections. So that's what I mean, as in everything has to match. So you have to make sure that your business is registered in your state. If your business is not registered in your state, please go do that first before you even come to me. Make sure your business is registered in your state. So you need to do that. So those are like the main three things: your business to be registered in your state, your tax ID number, and your MPI number. Then we're going to move on to the fact that you need to create a CAQH profile. Now, that is the database that is used for insurance companies to retrieve all your personal information. The database that the insurance company use to retrieve all your information that you have uploaded. I love the CAQH because if you decide to relocate to a different state, look, it's all still in that database, so you could be able to get credentialed in that state as well. So the CAQH, make sure everything is updated there, and you always have to do a attestation. I believe it's every 180 days that you have to do it. If your attestation has not been updated, rejection. They're gonna send you back an email stating, your CAQH attestation needs to be updated. That has to be done. You need to have a business bank account with the name of your business, because a lot of these insurance companies, no paper checks, only is alternative. Everybody's electronic right now. So make sure that your name of your bank account is the name of the business. And yeah, make sure that happens because you want to make sure you get direct deposit. I definitely am a fan of direct deposit because during COVID, I was working with a provider and she didn't set herself up with direct deposit, and it took 8 months for her to get her checks. So I encourage you to make sure you have a business bank account with the name of your business on the account and set up with direct deposit. Then you have, what else I see is they also look for your hours of operation, whether you need to put AM and PM. If you took a cultural competency training, they look for that. You can have several locations. There's nothing wrong with that. Definitely have a location where you want your correspondence to be sent to. That can be your personal home address if you don't want to use your business address. So telehealth. Now, one thing about telehealth, you can have your practice solely telehealth, but you have to make sure that you follow the insurance company guidelines. I just ran into a situation. I tell you, I got stories for days. I just ran into a situation where one of the providers that I'm working with, They stopped telehealth back in July of 2022. And we have been submitting claims. So one thing that I do is I could only go based on the information you share with me. So if you, not to say you're not upfront, but I can only go by what you say. So I literally kind of went above and beyond trying to get her claims paid. Like I be emailing these CEOs. That's how far I go. And come to find out, they kept getting rejected because she's an out-of-state provider. The address that they had on file, and this goes back to everything has to match, is not the address that she has been submitting claims with. So, yes, you have this address on file when I did the credentialing, but then when the claims get submitted to the insurance company, it has a different address. If things don't match, you're not going to get paid at all. So make sure everything gets paid. I mean, make sure everything is updated. Make sure all your information match. It's just like coding that I love. A procedure code and a diagnosis code must match. If they don't match, denied. So make sure everything matches, which telehealth, make sure that state is okay with performing telehealth. Number one, that specific insurance company. And when I say make sure, because if you are out of state and you're not credentialed with that specific insurance company, you're going to get denials. So make sure you understand that specific state that you're performing services in, their rules and regulations when it comes down to telehealth. And yes, majority of the time, if you are doing telehealth, you need to be licensed in that specific state. Then we have, are you going to have a office, which is fine, your EHR system. So I highly recommend providers to get an EHR system. I think I was kind of brought up with an EHR system, taught EHR systems when I started my career as medical billing, and it's the best thing to have. So definitely do your homework. I can give you some recommendations. I know a lot of times providers use Simple Practice. It's very simple, guys. I like it. Theranos, I'm utilizing Theranos as well. I have used Advanced MD. It's okay. I know ECW, but ECW, guys, is a little pricey. So especially if you are a solo practitioner, definitely try to go a cost-effective way as far as when it comes down to a clearinghouse, because I know a lot of times when you start a practice, things can definitely add up. So take baby steps, and then as you begin to grow, then you could probably venture off into another EHR system. Clearinghouse, yes, that's another fee, guys. So a lot of times with the EHR system, it's already integrated into your EHR system. Clearinghouse is basically a tool that is used to make sure claims are being submitted clean. If they are not clean, it's going to come back to you for you to correct and then for you to resubmit. So yes, I love clearinghouse. Is it going to tell you every denial? No, it's going to give you the basics. And when I say the basic, meaning like demographic information, it will definitely tell you sometimes, depending on what clearinghouse you use, that primary diagnosis code is not going to work. If it's going to tell you that NPI number, it's not going to work. So it tell you things like that. What else I see that I come across with the credentialing process? Fee schedules. You need to know your fee schedule. Fee schedules are so important. So once you do the whole process of the insurance company is going to verify, retrieve your information from the CAQH, they're going to send you a contract. And in that contract, they're going to have your fee schedule. They're going to tell you probably to go online, go do this, do that. And one thing I could say about insurance company, no one's mailing you anything. Everything is electronically. So make sure you definitely sign up for portals so you can be abreast to any changes that may occur. So fee schedules. Fee schedules. My favorite. I love to maximize them to get you paid. So your fee schedule It's basically going to give you an outline of the service codes that you can utilize, which means you can bill, and it's going to have a fee attached to each code. So that's where it comes in at, where you need to maximize your services. You need to have probably most likely create a projection and say, I want to be able to meet 50 patients for the month of July, which is fine. Now you want to see 50 patients. Now, within that 50 patient, what is your goal? What is your KPI? Yes, what is your goal? What number you want to reach to be able to receive that amount of reimbursement? So that's when that fee schedule comes into play. So if you have the procedure code, I'm mental health, guys, 90791, you know that's your intake code. And it cannot be billed with another code on the same day, so don't get greedy. Now, 90791, say that code is around $100. I'm just throwing out an example, right? And so that's not a good example because I got to do maximize, because you use 90791, you can't bill with another code, which is fine. But let me not say that, because when you see new patients, you can have that in your projection and say, yes, I do want to see 50 patients, but out of those 50 patients, I'm going to have 10 new patients, which is perfect. So if you get 10 new patients and the reimbursement is $100, come on now, do your math. You know what you're going to get. So that's what I mean, as in you can maximize your services. And then there's other procedure codes up there that may have a small fee. There's not a high reimbursement, but the way you'll be able to do it is you schedule that patient for another day to be able to come see you, so you can be able to perform that service. A lot of times these assessments, like for substance abuse, I see these insurance companies are paying for you to ask 10 questions. I think it's the audits. It is the audit 10 and the DAS. They both total together 20 questions. I'm going to pay you like $28 per person. So you times that, probably times 50, and that can be part of your projection. So I hope this was helpful. If you need any more guidance, please visit our website at Post and Claim, or you can set up an appointment. We can do a consultation to walk you through this process. Usually it's a $10 fee for the Post and Claim It documents training to ensure that you receive all your documents. See you soon.